Why are you not turning up? Why are you saying you will not respect that ultimatum which was set by the Minister of Health?
It's actually not a threat per se. We really want to come, but the circumstances that are happening make it not impossible for us to come, because let me explain. It started in about May this year when the Ministry of Education and Sports, together with the Ministry of Health, launched a new policy called the National Education and Training Health Policy, NETH in short, that had some things that were negative and not good for us to practice internship. They made it hard for us. For example, they planned to scrap all interns' allowances, among other things. And this same policy also was trying to make it that students can go for internship before finishing university, doing their final exams and graduating. So we were advocating for a long time and trying to reach the stakeholders so that this policy is withdrawn, because it was made without consultation from the various stakeholders. Yes. Therefore, the ministry failed to give us an official stance or in writing or something that says that that they will withdraw the policy and our allowances are going to be catered for. So if you want to deploy someone somewhere and you have promised them that they are not going to get allowances, then you expect that person to report seriously? Yes.
So I'm told you actually had a meeting with the Minister of Health to try and look into some of these things. What happened? We expected that at the end of that meeting, all was well, you will report for internship. And also, if you can explain a little bit, why is it important for you to receive this 2.5 million shillings on a monthly basis? I mean, some people will say you are not government employees. Why should you receive this money anyway?
Yes, technically, to an extent, we are working for the government because we provide a service. And this service we provide is, yes, we are under training, but we also provide a service. And this service, we work almost 24/7. Sometimes we have 36-hour shifts. So if I am working on the ward for all those hours, for all that time, then I have to be remunerated. The government that I'm working for has to make sure that it enables me to be on those ward rounds, on the ward. Therefore, if someone works 36-hour shifts, do you expect them to get another job for sustenance? We are also humans. We need food, we need accommodation, we need clothing, we have emergencies, we need data, we need airtime, we need everything, just like any other Ugandan. So if we are treating Ugandans, then I think the government should also cater for us. It's only natural that we ask.
Well, what would you tell somebody who says you are learning on the word and not working on the word, like you put it? You are learning on the word, not working on the word.
I think we are doing both. We are working under supervision from our inspectors, but also from our supervisors, actually. But also, we are providing a service. We do operations, we admit patients, treat them, discharge them, under supervision, yes, but we are providing the service. In the nights, sometimes when the consultants are not around, we are there on ward at night. Therefore, we are under supervised training, yes, but also we are providing the service. The person I would say is learning on ward and not providing a service is a medical student. For example, I started my going to ward in my third year, fourth year, fifth year, until the end. I've been going to ward, but by then I was learning and not providing the service. I would clerk patients and present to my supervisors, and they correct me, that was when I was learning, but not providing the service. In internship, I am under training, but I am also providing the service. That's the difference.
Well, what makes you special? Because I work in a media house. I also went for internship. During that period of internship, I was doing all the work that the journalists in the media house do. but I was not being paid for that. I was doing so because I was learning. So what makes you special? What do you think as people are still under training? Because when you're still under internship, you have not yet graduated. But we have had this argument where they actually say you are doctors and not students. We would want to understand that. What makes you different from other professionals that go on internship and are not paid?
Yes, I'm just curious. You said you were working internship as a journalist.
I was working. I had not graduated. You go for internship during your second year.
Had you done your final exams?
No.
Thank you. Now, I think you see what makes us special. It's that, yes, the internship you did during your days of journalism, during your school days, we do it. We do it. I've told you I did it from 3rd year to 5th year. I've done a series of exams that ensure that by the time I've graduated, I'm qualified and I can handle the patient of someone, of a Ugandan. However, this training now enables us to put things into perspective, how it's polished. I think I will call it polishing. And it gives you responsibility, because once you're in internship, the responsibility of that ward is on your shoulders. You run it. You get it? That's what makes us different. That this internship that you did, we also do it in med school. This other internship we are talking about is something we work for the government with a provisional license, and at the end of it, they will give us what? A permanent license.
Is there anywhere where it's written that while you're doing that other internship that you're describing, that you should be paid? Is it written anywhere, or it has just been a policy per se?
It's a policy, but also constitutionally, I think it should be. I think anyone who provides a service needs remuneration, and ethically, yes. Because I've told you the nature of work we do. I'm going to be on that road 24/7. Where am I going to get the money? Where am I going to get food? Where am I going to get sustenance? Where am I going to get accommodation? Where am I going to get clothing? You get it?
Assuming you're the one meeting the cost of your education.
Yes.
That's what you're saying.
Yes. So I think we are past that level of saying, should we facilitate them? Should we not facilitate them? I think right now the question should be how much. Because benchmark from other countries that are next here, East African countries, interns are being paid. Interns are being paid everywhere. I think this whole thing comes from one big misconception. That an intern is a student. And I think that term should be changed. We should advocate the term of internship to be changed. We call it maybe like junior doctors or something, because it confuses the public. Yes, the internship you did while in that these other courses, engineering, what that you also did, we do. We do it.
So you do internship twice?
Yes, imagine that. Imagine you did that, what you've told me you did, but after that, after your graduation, you work for government. Maybe you work for a parliamentary agency, for the parliament, as a parliamentary press for like 1 year. And then would you request to be remunerated?
As a volunteer, as what?
As, let's call it an intern. Would you request to be remunerated or not?
I think it will be at the discretion of the institution where I am to see whether it is in their means to be able to pay me or not.
I don't think it's like that particularly. Supposing that job you would work like, supposing you were on that job 24/7 and could not get another job, would you find it fair that you work for that party but you're not being paid?
All right, we've heard from you. Let's go to Dr. Kyabayinze. Here was also a medical intern in one way or the other, and from the arguments I've been hearing from senior colleagues and other people in the medical profession is that, why are you trying to deny these young people what you enjoyed? During your time, you were able to be facilitated as medical interns, and you didn't complain.
Thank you very much for giving us an opportunity. Again, my name is Daniel Kyabayinze. I'm serving in the Ministry of Health as a technical officer. In fact, I serve as the Director for Public Health. Of course, I finished my internship in 1999 and I was released in 2000. That means for the last 27 years, I know what medical practice has been in this country. I also feel what the interns currently are experiencing, because I'm one of those who, first of all, got 100% government scholarship to go to university. So I never paid any school fees after S6. I'm one of those, when I arrived in university, the university gave me what we call faculty allowance. They used to call it boom, where I would go and buy some books, buy a lab coat. They also facilitated my training. When I had to go to the community, the government then had resources to send me. But we are talking about 27 years ago. And in fact, we can say 30 years ago. The dynamics have changed.
What has changed?
One of the things I can quickly say, 2 weeks ago or 2.5 weeks ago, we released 2,417 interns, allocated them in 77 health facilities, with an average of over 40 per facility to go and do internship. Now, I can take you back at the time I'm talking about, where a total of 87 interns in the whole of Uganda.
Only 87?
80, and we are called junior house officers as we come into internship. When you come back for postgraduate, we call you senior house officer. You have graduated, you're a doctor. And when you come under supervision, you're either junior house officer or senior house officer. In fact, majority of the support for interns or junior house officers is done by the senior house officers who have come back to do their master's graduate studies. Nobody is in turn refusing anybody what they enjoyed. In fact, if we could rewind, when my parents were still in working, as soon as they graduated, they were given a car, and they were actually posted as they were finishing internship. So if you want to mirror and say, why are you not posting students as soon as they finish? I think we need to come to the reality of time. But just fast forward. Government has made resources available for the students. It's sponsored through education. Government also went ahead and built multiple universities and also liberalized education. So you are free to start a university, you are free to enlist students, you are free to graduate them and hand them over to do internship. So the good planning starts by saying, when I am starting to recruit students, all universities must submit their list to National Higher Council to say, this year I'll be able to release 400 students. We know what medical school training is. It's hands-on, it's practical. You must have the maximum support when training. Now, when the numbers have continued to swell and swell, and even other courses have been invited to do internship. Previously, internship was not for everybody. But even now, they have expanded to pharmacy, they have expanded to nursing. So the numbers have grown. I am also aware of some universities which can release over 200 students in a single year. There are some universities which are recruiting 3 times a year. What does that happen? That they distort the planning cycle for a government. Now, for us, the technical people, our work is simple. Plan for those who have been given, assign them where to go, and advise them. In fact, I heard my colleague saying they have given them ultimatum. For us, when we deployed, we went through a process of saying, who has gone to their council and gotten a pre-registration? Because the university submits a list to the Uganda Medical and Dental Council, so that when they are listed, then they send the names for Ministry of Health to find hospitals where we have consultants who can supervise them. So our role is to say, okay, how many wants to do obstetrics? Where do we have obstetricians? So we go to the hospitals and say we can send 40 to Naguru, because we know we have Dr. Albert, we have Dr. Irene, we have so and so to look after them.
Okay.
Now, are we denying them an opportunity? We have done the part of listing the 2,417 who reported in time, because there are others who are saying we're not on that list. Secondly, we have assigned them specific hospitals. Thirdly, all those who have finished are now away from the hospitals, apart from a few who did not pass, who will need to be taken for more support. Not internship is no longer automatic.
All right.
And finally, I want to say is that we've advised them that between 3rd and 14th, kindly report to where we have assigned you, or notify the people in those hospitals which date you will think you'll be arriving, because they have to plan and receive you and do induction for you. When that date passes, which is fast approaching,
14th
August, today is 11th, we are left with a few days for the interns to arrive.
Okay. So the problem is money. You failing to provide these people, because you hear from Dr. Ssegonga here. He talks about the kind of work they do on the ward. And some people have been actually warning and saying, once you do not pay these people, even those who are reporting now are likely to change. You're going to create a crisis in the health sector, because you do not have medical workers everywhere.
There are no medical workers everywhere. That's not true.
Okay, let's say they are not adequate.
Okay.
We are told about 85% of the people working in hospitals are actually medical interns, medical interns, intern doctors.
Okay, let me help you correct that narrative. The Ministry of Health payroll, just payroll, has over 60,000 health workers. And now you are telling me 2,400 are going to do the work, 85%, which is supposed to be done by the close to 60,000 health workers?
Yeah,
that's a fallacy.
Most of your health workers are never on station. They leave the work to these young men. We have seen this in health facilities.
Those statistics are they need to be cross-checked.
You're always busy in your clinics, private facilities.
So, how many health workers do we need to supervise one intern? Because remember, they need to learn how to prescribe. So if they came today, they're not going to get a pen and write medicine. They need somebody to tell them, what have you diagnosed? What is it that you're going to treat? Okay.
Have you heard about what they say, learning on the job?
Exactly. Have you ever taken your car to a mechanic and he gives it to a spanner boy to remove the steering wheel without supervising him? That's what you're saying they're going to do, that they'll come on day one and he says, oh, what's wrong? My hydraulic pump have failed. And then he says, spanner boy, remove the hydraulic pump. Day one? No. It's apprenticeship. And that's the difference between medicine and other courses. It's apprenticeship. You learn right from the nurse. How does the nurse move the patient? You learn from how they administer a drug. You practice how to operate. Your first operation, you are not alone. You are with somebody senior. You see how he holds the knife. He cuts. Then he says, next tomorrow, it will be you. You must be assisting somebody working for over a month before he can tell you you are ready to do it your own. Otherwise, you'll have mortality. Secondly, when you say that 85% of the work is done by interns, now the interns have left the wards. You know, they're in recess. The ones who have finished have left. You think the hospitals have closed? They are running because, first of all, this one we deployed, we expect them on 14th. They will take 1 week for internship. So we have a gap of 1 month. Has the hospitals or have Ugandan mortality gone up? Because you say they do 80% the work. So let's put the facts. I feel for the interns. They need to get an allowance. But let's match facts with the going trend.
All right. Is there going to be an allowance? You tell us.
Is there going to be an allowance? Government has said it wants people to report. Government has confirmed it's going to facilitate all the people they have been facilitating in training. Government is actually, according to my minister, is seeking for ways in which we can facilitate, because the policy must be given a time to slide in. I think that's what he's saying, that in May they heard of a new policy, and his heartache is the policy is going to apply as soon as he's coming out. So for me, that's where I need us to find winning teams? How could we put our minds together? What are the quick wins? You see, you cannot go against. It's easy to think you are on the winning side because you are still a group. You know, there are 2,400. If they all did show up in the hospitals,
All right.
they are winning because they have all collectively agreed. But we can't remember they each come from their individual homes.
All right. So
And
you are enjoying what they call divide and rule.
I am not dividing anybody. My mother took me to school and my father paid school fees alone. When I go to school, I don't study for my neighbor. So I don't need to be divided from anybody. And when I get a salary, I get it alone. And in fact, when you look at their transcripts, some of them scored AAA, others scored very little marks.
All right.
Are they divided by marks? Are they divided by character? Now they have a common desire to win.
All right.
It's better to coordinate, speak to us, speak to the powers that be, so that they can continually be facilitated, because education is facilitated.
All right.
Training is facilitated. Even apprenticeship for some courses, not medicine,
All right.
are not paid.
All right.
Because
Hold
you
it there.
mentioned it.
Let's go for a quick break. When we doctors. Now, Dr. Ssegonga, you've heard from Dr. Kyabayinze, who represents the position of the Minister of Health in this particular matter. What would you say about this? They are even open to more discussions on how you can find a solution. Do you have any proposals, or you're still adamant with your position that no allowances, no reporting?
Honestly, I think this is I think our stand comes from a place of deep contemplation, and it's quite calculative. We know very well that if we join this, if we report for internship, these people will not change their minds. They won't, trust me. Therefore, we are using this as a bargaining tactic, whereby we want them to fast. And besides, imagine you go to ward and then you report. Someone tells you, I'm not going to pay you, I'm not going to facilitate you, you come and work. Then you go there, you sign a contract, and the contract states you're not going to be facilitated, what, and you put your signature. If you work for 1 month, 2 months, 3 months, and you realize you have made a big mistake, how then will you come out to say that I made a mistake, yet you signed the contract? Literally, you signed a contract that says you're not going to be paid. How are you going to defend that even in court? So I think our priorities must be straight. All of us must be straight. We are telling the ministry and the stakeholders that we are very willing to work, because without this internship, we are not going to get our permanent licenses. Without this internship, we can't practice anywhere. That is for certain. However, we are not going to practice without facilitation. It just doesn't work for us. Some of us come from humble backgrounds. Some of us have started on loan schemes. We have sold lands to be able to complete university. And the day you graduate, your parents know that you are independent. And then imagine you're going now to work, but you don't even have 1,000 for chapati commando. This is, guys, I think if you're not in this situation, you will never understand. If you're not in this situation, you'll think, it's okay. But if you're in the situation that we are in right now, trust me, we don't want to be seated home right now. We are just doing it as a last ditch effort, the last kicks of a dying horse. This is how far we've been pushed to the wall, and this is what we are doing. But believe me, if tomorrow morning they come up and say, this policy has been withdrawn for review, your allowances will be given, trust me, even tomorrow morning, before 14, we shall all be there. Trust me. Doctor, you can come to Ginger. You will find me there. The moment you give us the white smoke,
you were posted in Ginger.
You will find me there.
You were posted in Ginger.
You were posted in Ginger.
Yes.
Is that where you come from?
No, not really. But
You don't come from Ginger. All right. The government says it does not have the resources required. At the moment, you're demanding for 2.5 million shillings. Is there a threshold? Are you ready to, sort of go down, probably revise the figures involved? Because from what I heard Dr. Kyabayinze explaining, that the government is looking into this issue, but it might be the failure to realize the resources. Or maybe you can advise government, where do you think they can get the resources to fund amidst all these shortages that we have?
I am not a technical person in finance department of the government, but from my impression and majority of Ugandans, when you look at the way government spends on some things, you're really inclined to say that money is not the problem. The money you're asking is not too much. Maybe the question is, are we a priority for them to spend that money? For example, in 2021, they disbursed these funds. The 2.5, the President of Uganda, His Excellency Yoweri Kaguta Museveni, made a directive that interns be remunerated 50% of what the MOs were getting at that time. And that cohort got that money. Where did they get that money? They got the money and they paid them, but without
How many
warning.
people were they? How many interns? Remember, we're coming from Korea. How many interns were they?
I think there were about 2,000.
No.
There were how many?
No. This is the biggest number we've released in the last 2 years. Last year we released over 2,000. Same this time we've released 2,500. The number of interns keeps escalating and increasing. So
is that also a problem?
No.
Is it something we can control?
But that's a good
The
thing
number
for the
of health
country.
workers we churn out.
It's a good thing for the country.
We are a developing country, and everybody has been told study science because science courses pay better.
And you need
we need to support science development.
Here they are.
And when we support them, we need to facilitate their learning. So for us as technical, what have we done to support them? We have put a list for where they can go and do internship. We have, and I hope some of them are grateful that has happened, because there is a year when we didn't post you. It's also possible. This thing of saying the world will collapse when there are no interns. There is a year we didn't post interns. You know that. So the threat doesn't hold. For me, I know there is a willing government. There is a willing government, and our minister, in fact, found some of you holding placards at the gate and said, "What are these holding placards for?" He said, come in, bring in a few policemen, leave them in. So he took you to your office. His officer said, "What's the issue?" "Oh, okay, come tomorrow and we have a meeting." And he put time aside from midday to 6 in the evening, almost 5 hours. I was in that meeting. You negotiated, you told him your wishes, he explained the things I am actually telling you now. You were leading that group. He told you, we've posted you. Go to where we've posted you. We have allowed some to get allowance. We are going to continue looking for resources and talking to the powers that be, so that government can see that if the budget is not enough, maybe we make a reduction for everybody, everybody to fit in what's still available. But also the others were saying, okay, let's not lose the opportunity of not going. We shall go as we need to. And he said, let's trust each other to do his part. And he said, not giving any other person an ultimatum that you won't come, because we are building goodwill. Government has been dispersing money for interns from time immemorial.
All right. There's a question coming in from a listener who says, intern doctors need facilitation for rent, food, transport, etc. Would the ministry officials work if their allowances were withdrawn, yet they are better off already?
For sure, we are better off, but we are not in the same position. We can compare likes to likes. You are coming to train. By the way, there are so many doctors who are not employed. Let's also remember that. Every year we release so many health workers, and our budget and system and pay, the economy, cannot take in all the health workers. Recently, government readjusted the structure. Where we had about 200 people in a health center, the number was doubled. So now there is room to admit more people in health centers.
So why don't you recruit these people?
No, let me finish this narrative, because I'm trying to highlight the goodwill and the number of people who are available for absorption. for the last so many years, many people who come out end up joining private practice because their budget to absorb everybody is not available. I am sure when that money becomes more available, more people will be admitted. Now, they change the pay and enhance the pay for scientists. And I'm hearing recently, even the artists have been enhanced. So, as the others increase those who can be able to supervise the interns, because the number is increasing, as government sends health workers to health center 3s and doctors, many of these people will be probably employed at that level, which has not been the case before. We are looking for an opportunity. What is the win-win? If you give a government an ultimatum, I don't think it's the way to go as professionals. But you can be advised otherwise. Because for me, I'm here only to give advice. I can advise people, and let me be on record. If you can afford to report by 14th, go and report. And when you report, ask the health worker or the director of that hospital to send back your name to the ministry that you've arrived. Because, for instance, I have seen some hospitals which have been able to give their risk requests, like Mbuya General Military Hospital. Almost all their positions who are deployed have arrived. Kawempe National Referral, maybe like 50% have arrived. Mbale, 100% have arrived. Mbale Regional Referral Hospital. So for you, when others are giving Nagu Referral Hospital because it's near in town, about 50%.
When I pointed out that...
so I am just letting you know, Nsambia St. Francis
Dr.
Hospital,
Kyabayinze,
which is a private hospital, by the way, an NGO, has already shown almost 40 people are on the ward. Now, when ministry is going to look for resources...
Now, that's a contradiction.
No, let me finish this statement.
That's a contradiction.
Now,
Earlier I told you that they had arrived, and you said they have not. They're in the process. Now you're saying...
You see some hospitals still have zeros. You see some hospitals still have zeros. The list is here, I said this, and there are 77 hospitals.
Hopefully it is not AI generated.
It could be anything. But for me, I'm advising, if you have people who have... Okay, let's use this as a limb test. Call Mbale, call Nsambia Hospital, and ask them, are there any new interns who have arrived? Because then that will be, and if any of you are still on the call, please encourage your friends. If you are arriving, you are reporting, then don't stop those who are willing to go, because this is a hard stop. On 14th, we shall take a tally. And when that tally ends, according to us, our schedule of work of deploying internship this year has ended. We're not going to go backwards as technical people that we know that the commissioner for this is responsible for deploying internship. He has finished his work. Now it goes to the regional referral hospitals to start supervising. For us, we shall come back after 1 year who has passed. Then you will not be telling us also and so didn't come.
All right. I've been hearing from the Uganda Medical Association, and they were saying whatever deaths will be recorded on the ward as a result of this mishap, the burden will be on you workers in the Ministry of Health who are taking this decision. Are you ready to carry that weight?
But you see, I signed a contract for a job, and I have responsibility in terms of reference. There's nothing to take responsibility about. Whatever is given to me, I'll take. Why? Because you see, we have a calendar. The universities have a graduation date. So as these ones are waiting, next year there will be another equal number graduating if they have not arrived. So who do you take away the provision for? Will we wait for these ones, or will we deploy the ones for next year?
Are you ready for the crisis? Because we're told there might be a crisis.
I think there can be a violent crisis if the interns decide to go on streets and riot. I am not ready for that crisis. Why? These are highly trained people. For 5 years we've been training them.
They will withdraw from the health facilities. That's what I'm implying.
Which ones?
And
the rest of the medical workers? They want to join to withdraw their services?
Yes.
Oh, I had not known that.
Yeah,
is that what they're planning?
Members of the Uganda Medical Association.
I am a member. I am here. I am a member of Uganda Medical Association.
You are a well-catered for member.
Yes.
And you're not feeling the pinch.
I don't want to sound arrogant. I graduated many years ago. As the Gen Zs live in the Gen Z period, it's not like me. So I cannot compare myself to them. For me, I made right decisions then, and the privileges which were in my country are different from now. So I cannot equate myself to what they are going through. For me, in my medical class, we are only 21. They are now releasing numbers and numbers. For me, as I was leaving university, the positions were available.
All right. Let's go very quickly to Dr. Silva before we hear from the listener. Very quickly.
I think it's a good thing. By the way, we should all be proud for Uganda, because right now the doctors are more. Because if you compare the doctor-patient ratio, have you looked at the statistics? You find that Uganda is doing not so well. The recommended World Health Organization ratio should be 1 doctor to 1,000 patients. If you
Continue.
Maybe you quote. I can also quote. But from that, 1 to 1,000. But actually, it's even in the policy on that situation analysis page. If you read it, it's 1 to 1,000. Yes. Actually, but if you compare countries like Rwanda, it's 1 to 8,000. Kenya, it's 1 to 17,000. Do you know what it is in Uganda? It is 1 to 25,000. Remember, doctor, in your days, you were 25 in your class, but the population was low. The population of Uganda by then was also low. But now the population has increased. There is demand for these health workers. And it's a very good thing that actually more doctors are coming on board to provide the service. Right. But if they come on board to provide the service, why don't you want to sustain them on the wards?
So
all right.
let me make a clarification.
Very quickly.
So just to give you some numbers, in 2016, we had 965 intern doctors. Interns, medical interns. Now we have, the number kept rising. Now we have 2,400. So we have more than doubled in 10 years.
All right.
So that also tells you that the need and the ability to absorb is being constrained.
The ability can be there if you plan accordingly.
I want to begin with you very quickly, your responses, and then we go to Dr.
I
Silva.
really regret that maybe my explanation sounded arrogant. I did not intend to be arrogant or aloof for those who are looking for facilitation, because all of us are a responsibility of government. Can I repeat that? All of us in Uganda are a responsibility of government. So government must find priorities where we can all live and survive. And the money which comes to us, let me remind you, it is allocated from Parliament. Ministry of Health does not give itself money. And we currently have a deficit. Maybe if I gave you the details of the money we need, if we are going to give everybody allowance, we still have a deficit of almost 15 billion. Because those, the government-sponsored people currently in the medical teams are 476. 1,940 people were privately sponsored. That is equal to saying 31% of all these interns we are talking about, 733, came from only one university. So we need to address recruitment. We need to address planning, so that one university cannot account for 30%, because we have 13 universities.
All right, very quickly, you need to wind up your submission.
I'm winding up. I'm calling on my colleagues, the doctors, those who are in position to be there by 14th, so that they can be on Saturday inducted and their reporting back is known. Please do that.
All right.
However, if you choose to do otherwise, also advise us that we will not show up, but make it in writing so that we can plan otherwise, so that we can quickly also work out on how to deploy people where it's more critical, because some places will require actually interns.
All right, very quickly, Dr. Silva, your closing remarks as we come to the end of this discussion.
My closing remarks are to the President of the Republic of Uganda, His Excellency Yoweri Kaguta Museveni. Please, this is a matter of national importance. I humbly request that you intervene, because the last meeting with the Honorable Minister, Dr. Chris Bariomusi, said that the issue was in Cabinet, and we all know Cabinet is headed by the President. Please, we humbly come to you and we ask that you look into this matter with urgency. The other thing is to the Ministry, The good thing, we have an emissary here who will deliver the message.
Mm.
Please don't take the deadline of 14th so personally. We are, if we fail to report by 14th, we shall always liars and see. But we are waiting for Cabinet to resolve this issue and
All right.
Parliament.
All right. With that, we